Darlene?
I'm here.
Oh, there you are. Okay.
I was there for the whole time. I don't know what
Oh, that's
happened.
okay. That's all right. How are you?
I'm good. How about
I'm gonna put you on mute for 1 second. Until we wait and see if anybody else is coming.
Yeah, I have like two or three of my friends, my classmates.
Okay, nobody's
So,
here yet. Okay, I'll wait a
okay,
few more minutes.
okay, I'll check on them out as well. I'm gonna
Okay.
switch to the computer, okay? Is that okay with you?
Say that again?
I'm
Yeah,
gonna switch to my computer.
yeah. And I'm gonna turn my view off for a minute and wait to see if anybody else comes.
Okay, great, no problem.
Darlene? Darlene, are you there? You're on mute. There
I'm
you
gonna
go.
move to the computer now. Is that okay?
All right, I'm gonna start. Okay. I'm gonna start.
I'm joining in a few.
What?
Alan is gonna join.
Okay, but I'm gonna get started, okay?
Okay, okay, no problem. Let me join.
Okay. All right, can you see my screen? All right, I'm going to share my screen. Can you see my screen?
Yes, I can see your screen.
All right. All right, so it's only you and I for right now. The front page is the same as exam one, okay? 50 questions, 5 math questions, and it tells you right here what the math questions are going to be, okay? And I think at the end, no, I didn't. Okay. Let's see. There's no, to use your readings, your PowerPoints that you get every week, your concept recordings, your lectures, your quiz rationales, all those should be used as a study guide, okay?
Okay.
Or study, okay? All right. So let's review the concepts. All right. These are concepts from week 4. Okay, so I'd like for you to review the facts about vulnerable. What do we know about vulnerable populations? Here's some highlights, right? Poor health outcomes, right? Increased chronic illnesses, higher rates of communicable diseases, maybe higher exposure rates to crime and violence, maybe domestic violence, maybe poor living conditions, poor dietary health. Okay?
Yes.
So review those facts about vulnerable populations in general. And then what are we most concerned about teen pregnancy? All right,
The
what are some,
diet,
what? Their diet, yep.
diet,
Dropping out of school.
Dropping out of school, maybe late prenatal care or no prenatal care.
No pre, yeah, being afraid to even say they're pregnant.
Yep, exactly. What do we want to assess in a teen mother after she's had the baby? Does she know growth and development? Does she know milestones of the baby? Does she know how to meet the baby's needs, right?
yes.
Yeah.
Does she have support systems? What's the environment like? Is it a calm environment? Is it a hectic environment? Are people supporting her or things difficult? Right?
If she bonding with the kid,
Is she bonding with the baby? Does she know how to meet the baby's needs? We know that during adolescent pregnancies, there is an increased risk for domestic violence. Making sure you assess that. Right? We also know there's a correlation between poverty and poor health outcomes for teens. A lot of risks for adolescent pregnancy. So review all of that. Okay. LGBTQ population. What's the first thing we need to be doing when we're caring for this population?
We
check
need
ourselves,
What?
check our
uh,
self
it,
feel.
the empathy, the putting, what's the word for it? Cultural competence.
Competency. Well, first we want to be assessing our own feelings, right?
Yes.
We want to make sure we are our feelings. Do we have any biases? Do we have any prejudices? Do we have any ill feelings towards different populations? Because we're not going to be able to culturally competently care for these clients of this population if we haven't really done a good assessment of our own feelings to make sure that we can care for them without any attitudes or different beliefs or values, right?
Yes. Being
Right.
non-judgmental.
Yeah, we have to get rid of all that. We have to assess our own feelings. We need to review. I want you to review the health disparities that commonly are associated with caring for the LGBT population. Maybe depression, anxiety, substance abuse. Certainly at risk for STDs. Maybe increased risk for homelessness. And I want you to review appropriate and inappropriate questions that we might ask, this population. How do we ask questions without assuming heterosexuality? What might be what might we ask?
Yes.
We might ask instead of are you married? Maybe do you have a partner?
How do you call your partner?
What do you call your partner? Right?
What would you be referred to?
Yeah, exactly. So we want to be sensitive to how we ask the questions. Very non-judgmental questions, very open-ended questions. Right? We know that over the lifespan, this population, it's getting better, but we know they're constantly at risk for, morbidity and mortality, right? Judgments, feelings, assumptions, right? How do we provide a safe environment for this population to be able to talk about their gender identity, their sexual orientation? How do we support them in a positive way? Right? What a review with this is all in your readings, mental health needs of LGBTQ population, or excuse me, for the youth in this population. All right, so there are some pretty common mental health needs for the youth, LGBTQ youth. So I want you to review that. Okay, what do you think they would be?
Have a designated place where it says we are giving care to LGBTQ population.
Right? What do you think are some common risks or common mental health needs of youth in particular? Peer
So-
pressure, bullying,
Yeah, bullying. Yeah,
harassment,
yeah.
judgment,
Suicide.
suicide risk. Absolutely. Okay, so review that. And then with regards to mental illness, there's a few things I want you to review. Like the LGBT population, we also have to review the importance of our own self-awareness to mental health, people with mental health issues. How do you feel about substance abuse? How do you feel about drug abuse? How do you feel about methamphetamine abuse? How do you feel about people that are bipolar? Can you care for them in a non-judgmental way? One of the
I've
medication,
seen,
go ahead.
Professor, I've seen that come up a lot this past couple weeks. Is the like first is review the importance of your own self awareness
Right.
first,
Mhm.
and that's just so if you're like biased or whatever, you would talk to your manager and like uh, um, but uh, ask someone else to care for them or what? Because I always
Well,
see that first.
right. So what if you're unable to overcome, let's say, Alan, you have prejudices, you have biases that is going to prevent you, and let's say you can't work through them,
And
right?
we have
You're
Yeah.
going to have to discuss this with your manager or your
Yeah.
lead or whomever, because you will be a liability trying to care for a specific vulnerable population, whether it's
Yeah.
homelessness, teen pregnancy, LGBTQ, people with mental illnesses, people with substance abuse. If
Right.
you, it's fine to assess your own feelings, but if you can't separate those feelings, right?
Yeah.
And you're going to,
I'm not saying me personally. I'm
no,
a
no,
live
no,
and let
that's
live
a great
guy.
question. But
But
that's
uh,
why we assess our
but I see.
self-awareness.
But assessing the self awareness is before you do anything else
Right,
with
right,
vulnerable populations,
right.
stuff like that.
And you're either able to manage that self-awareness if there are issues, or you're not. If you're able to manage and work through them, then of course you'll be able to competently take care of the client. But if you're not, somebody else needs to be caring for the client, because you don't want to take those judgments or prejudices or biases into caring for the client. It won't end well, right?
Yeah.
I want you to review the teaching plan. We talked about this in class for a particular medication that's used to treat bipolar patients, which is lithium. We went through
Yeah.
this in class. There's a few teaching points that you need to know. Okay.
yes.
Review the interventions for eating disorders. Let's say you're caring for a client that has eating disorders. What kind of interventions are appropriate for that group? And we went through that in class. So I want you to review that. What if you're,
Mouth care.
pardon me?
Mouth
Mm,
care
Mhm.
is one of them.
Assessing for any comorbidities, any mental health issues
Yes.
that might be going on, right? Maybe if it's an eating disorder, maybe completing nutritional assessments, right? So have a look, go back and read. If you're not comfortable with that, you can go back and read through the chapter in the book of, or read through the section of the chapter in the book that talks about eating disorders. What if you're caring for a client with suicidal thoughts, suicidal ideations? What questions might you ask? We went through this in
Um,
class.
do you have a plan to harm yourself?
Do you have a plan? Do
Have
you
you
have the
ever
mean? Go ahead.
have you ever attempted to kill yourself?
You ever attempted? Do you have the means to complete your plan? Right? I mean, we need to assess how serious they are. Have you ever thought about this before? What do we need to think about when caring for clients that are experiencing delirium tremens, DTs? What's important? What do they look like? Seizures, right? So we need to think safety, right? Seizure precautions, safety precautions. We don't want them hurt. So what kinds of things would we think about? For safety? Maybe having medication on hand. If they were seizing.
Oxygen.
Oxygen, padded side rails, suction. Safety is the most important. All right. Locked cabinets. We don't want them in a room that doesn't have, they have open access to things. Right?
Yes.
I want you to review the mental health disorders of general anxiety disorder, bipolar, and alcohol withdrawal. What do those look like? What might clients be experiencing? If you had a client presenting to you with generalized anxiety disorder, bipolar, alcohol withdrawal, what might you observe?
The shaking, irritability.
Yep, go back and review that. Okay. With regards to alcohol, tobacco, and other drugs, and what's concerning about the nicotine ingredients? What do we need to know? What do we need to teach about vaping? About the oils in the vapes, the oils in the e-cigarettes? They're poisonous, right?
Yes.
Right? If a client tells you, oh, I did stop smoking, but I'm still vaping, that's not good, right?
No, not good.
It's just as dangerous.
Smoking.
With regards to blood alcohol concentration, there's 5 different things that compose of determining a concentration. It's not just what you drink, right? It's how much you weigh. When's the last time you ate? What's your weight? What's your gender? What's your metabolism, right?
Mm.
There's several things. How much can the liver metabolize of hard liquor, of beer, of wine? That was one of your quiz questions. Go back and look at that rationale. We talked about the review teaching plan for client who uses e-cigarettes. Kids are at risk of poisoning. I want you to take a look at what might you see, what might you assess, what might a client present with for a client using amphetamines, methamphetamines, cocaine, opioids, alcohol. What might they present with? What are their vital signs going to look like? What is their behavior going to look like? Right? Review how psychological dependence can occur with chronic use. Right? What does chronic drug abuse look like? What does chronic alcohol look like? What's harm reduction? Right? What do we consider risk factors for the vulnerable? Right? That cause them to use alcohol, tobacco, other drug problems. Right? What leads them to that? What are their vulnerabilities? Is it lack of education, lack of healthcare access, lack of access to programs to help treat issues? Do they live in poverty? They don't have access to clinics or primary care to get medications, treatment that they need. Okay. In week 5, we talked about hospice, death, and dying. A few things to review. I want you to review the stages of grief. Because let's say you're working with somebody who's in hospice or even palliative care, right? Everybody might be at a different stage. right? Some may have accepted what's going on. Some may in the family may be still in denial. The client may still be in denial. So if you're given a scenario about somebody's behavior, be able to identify what stages of grief they're in. One of the things that's important for hospice clients is autonomy, is their ability to participate in what they want, to say what they want. All right, we want to have them as part of the plan of decision making. They've already lost so much. So we want to have them, the importance of autonomy. Review that. And remember, we talked about the difference between hospice and palliative care. Right? Palliative care is supportive care. Supportive and trying to improve the symptoms, improve the quality of life. Once they get into hospice, it's usually within 6 months, we talked about in class. All the treatments have been stopped, right? Hospice is, I mean, you will be providing palliative care in hospice, right? But palliative care can be, let's say I'm diagnosed with cancer today and I have 2 years to live. Palliative care is all that care we do in the next 2 years. Supportive care, symptom management, comfort care. And then when I move into hospice care towards the end, that's different. All treatments have been stopped. It's really comfort care and end of life care, right? What are some observations that you may observe in a client who's towards the end of life? What do their vital signs look like? What is their behavior? What is their skin? What is their breathing like? Review that. And I know we didn't. What? Yep. Go ahead.
The giant stroke.
Yeah. What does that look like? Exactly.
They are
What
more
might you
likely-
observe?
Yes.
One thing we didn't talk about in class, but I wanted to put in my review is the coroner, for deaths.
Yes.
Why may a coroner investigate deaths? This is in your reading. For what reasons? Right? We know the coroner will investigate deaths that have any kind of suspicion. Right? The question of cause. Right? Maybe it was an accident. Maybe it was an injury. Right? Are there questions surrounding the death? Maybe they didn't have a primary care provider and we don't have anywhere to go to ask. What's the medical history? So that's another reason. When we're talking about spirituality and cultural care, I want you to review, there's a chart in your book that talks about different ethnicities and some of their cultural beliefs and attitudes and preferences. I would like for you to review the African American, the Hispanic, the Native American, and Jewish cultural preferences. Okay. Maybe food preferences, comfort preferences, healthcare preferences, end of life preferences. Okay, and we talked about this a lot in class already, is what's culturally competent care? What is it? How do you know you're providing culturally competent care?
It's when you put your own culture to the side and try to understand the patient's culture and to provide an efficient care according to the patient beliefs and culture.
Right. You're looking at the patient through their eyes, through their values, through their attitudes, beliefs, practices. You're trying to incorporate as much of their culture into their health plan, right? So you're able to look at the client through their eyes and their culture, right? And there may be issues. There may be language barriers. There may be literacy barriers, right?
Professor Marvel, you said we need to be more focused on the Native American, African American, and the Latino community?
African American preferences, Hispanic, Native American, and Jewish.
Jewish.
Just know overall what an overview of their cultural preferences. Okay.
Okay, thank you.
There was a question on this week's quiz with regards to steps necessary for ethical decision making. What's the first thing we need to identify before we have the conversation of ethical decision making?
What is the issue?
What's the issue? How can you have an ethical decision making conversation if you don't know what the ethical issue is, right?
Yes.
A couple of ethical principles. What is non-malfeasance and beneficence? Beneficence is do good, right?
Yes.
We as nurses try to practice the ethical principle of beneficence all the time, doing good, right? Being an advocate, doing good for our patients. Non-malfeasance is do no harm, right? And I use the example in class. Let's say you're catheterizing a patient and you contaminate the sterile field. What do?
You
Keep
get a
going
new
or start over,
Mm-hmm.
right? Do no harm. Those are key principles that are really part of the foundation of our nursing practice. Do good, do no harm. We advocate for distributive justice, which is everybody has the same access to resources and healthcare. And then we always practice autonomy, which is including the clients in every part of their care and their decision making and development of a plan, right? And then review the guidelines for documentation. It's pretty clear. We chart objectively, correct? Factual. Patient states their pain on a scale from 1 to 10 is a 3. Wound looks red and is draining. Patient had 60 cc's of urine output. Factual. We don't want to be charting subjective information like patient seems angry. Patient is grumpy today, right? Unless they tell you, I'm feeling very unsettled today because I didn't sleep well. Well, document that. Patient states that. Don't make the assumption that, oh, patient's grumpy today, patient's angry, patient's non-compliant. Patient doesn't want to get up and walk today. They appear tired. Well, how do you know they're tired? How do you know So charting is done objectively, not subjectively, correct?
Yes.
Okay. And then what we covered this week, environmental hazard. Well, who is at risk for environmental hazards, right?
Children.
Certainly vulnerable populations are at risk for environmental hazards. But let's say you live in a community that is close to transportation hubs. Do you have review populations? Maybe those populations are at risk for air pollution, maybe at risk for asthma, right? What if you live near in a community that has industrial waste sites? Well, those populations may be vulnerable to air pollution as well. Right? So review populations that are at risk for environmental hazards. Kids are at risk because of their immature immune systems, their immature liver development, their inability to advocate for themselves. And then we talked this week about occupational health and how to do a safety assessment in the workplace, right? The nurse needs to understand what's the purpose of the business. Is it a hospital taking care of patients? Is it a car plant making cars? Is it a recreation center providing equipment and activities for people? Is it a restaurant that provides cooking and ovens and stoves and what? All those different places require different safety assessments. What is each employee's job description? What are they responsible for doing? Do they have the right training? Do they have the right education? Do they have the right equipment, protective gear to carry out their job descriptions?
And is that's a lot where OSHA comes in,
Yeah.
right?
OSHA has
And
everything to do with occupational health. You start having issues at your place of business, maybe an unexpected death in the OR, maybe an employee got burned that's behind a grill, there was a fire in the place. OSHA, Occupational Safety Health Administration, will come out and investigate all of those. They're responsible for enforcing the safety guidelines that have been put in place for a specific business. Absolutely. Okay. And then lastly, we talked about teaching, the different domains of learning. Remember, your cognitive is your thinking. You take in all this information that you hear, read, see. You use that information, think about it, and make your informed decisions, right? Based on that information. Affective is the feeling type of learning. We all have these three, all of us. We possess cognitive, affective, and psychomotor domains of learning, but usually one is pretty dominant, right? So affective is your feeling, your attitudes. Does the patient understand the severity of their illness? Right? What are their feelings about it? Are they going to be serious about it, or are they going to blow off the teaching? What are their attitudes, values, feelings about what's going on with them? And then psychomotor. I had a lot of kids in the schools that were key psychomotor learners as I was teaching them how to use their glucometer, how to give themselves an insulin injection, how to use their pump. You know, that's the hands-on. The psychomotor is the hands-on. We all possess all three, but we all need to be mindful that when we're teaching, do we have cognitive learners, affective learners, psychomotor learners? And what if we have all three? How do we develop our teaching to meet the needs of everybody? What are some learning barriers? Right? We talked in class about low literacy. The one thing I didn't put in here is language barriers. Language barriers are a huge learner-related barrier. Low literacy. What if you're teaching to people that may be visually impaired, auditorily impaired? What if they're not motivated? What if they lack self-confidence? Just go back through your lectures. I mean, if you listened in lecture and took notes, you're going to be fine. Go back through your concept recordings if you need to. Definitely, I would read your rationales again from quiz 3 and quiz 4. There's a lot of great information in that. And then go back to your readings if you need more. But those are your resources. You know, if you're doing all those, you're going to be fine with the exam. You know, go back through this recording, see what I put in the boxes. Review those specifically. Okay? Does that help?
Yeah.
Mm.
Yeah.
Do you have any questions?
Professor Marvell, can you go over the um the abroad for the article for nursing?
The what?
Okay. I have it in the quiz. It was one of the questions of the quiz, the one that says the board, it gives it gives all the details about how the job is. It's abroad, but it's not specific. The specific rules will be determined by the facility.
I'm not understanding your question.
Okay, let me go over it.
Do you remember which quiz it was? What question?
Yeah, week 4 and 5.
Okay, well, we had a quiz. Week 4 was an exam. So you're saying that quiz?
It's not the quiz, it's the Kahoot, in a Kahoot. It was one of the Kahoot questions.
Oh, what is the
But
question?
was it about the ethic,
The addict?
the nursing board ethic rules?
Ethics.
Okay.
So, and you're talking about each facility may have their own set of
Yes, so
ethic rules.
the
That's
ethic,
Is
fine.
that what you're trying?
yeah, the ethical and legal issues.
Yep. So each facility may have different ways to address their ethical dilemmas, but the point being there has to be an issue identified before they go through that process. So it is common that different institutions may handle ethical issues differently, but the point is that an ethical issue has to be identified in order to start going through that process. That's that ethical decision-making process.
Okay.
All right. So the point is there has to be an issue identified first. That's what you need to know. Okay.
Okay.
Any questions?
No, it's just study till Tuesday.
Study study the review that I just went through with you.
Yeah.
That's it.
Is there any way I can like access that PowerPoint that you had in this? No. All right.
Those are my notes.
All right.
But you can go
Well,
back
thank
through
you very
you can
much.
go back through the recording.
All right. Sounds
All
good.
right.
Well, thank you very much.
All right. And then I if you need any help with any concepts over the weekend or early next week before you take the exam, if things are still unclear, set up a meeting with me, set up a Zoom, and we can go through whatever you're still struggling with, okay?
Sounds good.
And thanks for attending today. I appreciate it.
Yeah, no
Okay.
problem. Thanks
Thank
for
you.
having it.
Yeah, you're welcome. All right. Talk to you later.
Okay, have a good one. Thank
All
you.
right. Bye-bye.